Today I'm going to be talking about pneumonia. Pneumonia is excess fluid in the lungs caused by inflammation of alveoli sacs. Pneumonia is most commonly caused by bacteria, but can also be caused by viruses and even fungus. Pneumonia can also be caused by aspiration of water, food, fluid, or vomitus. There are a few different types of pneumonia. Community-acquired pneumonia is pneumonia that is contracted in the community outside of a healthcare setting. Hospital-acquired pneumonia is pneumonia with an onset or diagnosis of pneumonia that occurs 48 hours after admission to the hospital. Ventilator-associated pneumonia is pneumonia with an onset or diagnosis that occurs 48 to 72 hours after endotracheal intubation. In someone with pneumonia, you'll expect them to have an increased respiratory rate, difficulty breathing, coughing, chest discomfort related to the coughing, a fever, and sputum that is yellow-tinged or rust-colored. Other physical findings associated with pneumonia include chills, a flushed face, diaphoresis or dehydration, and crackles or wheezes. When someone has pneumonia, you'll want to do a sputum culture, and you want to make sure that you do this before the patient starts any antibiotic therapy. You also want to test for elevated white blood cell count. You want to do a blood culture to rule out any organisms in the blood that could lead to sepsis, and you want to look for an elevated BUN or sodium level that could indicate dehydration. Other diagnostic procedures include a chest x-ray and pulse oximetry because clients with pneumonia will usually have an SpO2 level less than 95%. Some nursing diagnoses for patients with pneumonia include impaired gas exchange related to decreased diffusion at the alveolar capillary membrane level, potential for airway obstruction related to the excessive secretions, or potential for sepsis related to the presence of microorganisms in a very vascular space, which is why you want to remember to do that blood culture. When it comes to caring for a patient with pneumonia, you want to encourage your patient to use the incentive spirometer to prevent alveolar collapse. You want to try and position your patient in the high Fowler's position as long as they can tolerate it. You want to encourage coughing to remove the secretions. You want to administer oxygen therapy to keep your patient's O2 stats above 95%. And you want to administer breathing treatments as needed or as ordered by the doctor to help your patient breathe. And you want to just monitor for skin breakdown around the mouth and the nose. As for treatment of pneumonia, there are a couple of different medications that doctors will prescribe. Antibiotics are given to destroy the infectious pathogens causing the inflammation in the lungs. The most commonly used antibiotics include penicillins and cephalosporins. Bronchodilators are given to reduce bronchospasms and reduce irritation. Albuterol can usually provide rapid relief, and ipratropium will block the parasympathetic nervous system, allowing for increased bronchodilation and decreased pulmonary secretions. And last but not least, anti-inflammatories will be given to decrease airway inflammation. And these anti-inflammatories usually include glucocorticosteroids, which would be fluticasone or prednisone. And last but not least, you want to educate your patient. You want to make sure that your patient knows the importance of taking all of their antibiotics as prescribed. You want to encourage periods of rest as needed. You want to encourage your patient to maintain proper hand hygiene to prevent infections, and you want to encourage your patient to avoid crowded areas to help reduce the risk of infection. Remind your patient that treatment and recovery from pneumonia can take time, and it's not going to just happen overnight. And you also want to encourage immunizations for pneumonia in the future, such as Prevnar 13 or Pneumovax 23.